I don't want government interfering in the relationship between patients and doctors. I want a vibrant healthcare market that lets patients choose the healthcare options that are right for them and their loved ones. The right of each person to protection of health does not imply the government must provide healthcare. The right to have food in order to live doesn't require the government must own the farms and raise the crops.
It seems to me that what we've got is a ship that's sinking. We've got a great big hole on it, and the big argument is over who's going to be the captain.
What good is having health insurance if you can't find a doctor to see you? So I think the bottom line is that if you want doctors to focus on quality, spending time with patients, calling patients back, improving their access, replying to them on email, you need to change the system to encourage them to do that. And really, none of the proposals on the table are doing that right now.
Our American Academy of Orthopedic Surgeons has come out opposed to a single-payer plan.
And I'm not into a government-based plan. I don't trust it. And I don't care who's in the White House. I don't trust it. I'm an ER nurse. Americans will circumvent any plan that doesn't meet their needs by showing up in my emergency department.
If you make something free, people are going to use more of it. Even if you change how you use it, they're still going to use more of it. Do we really want a healthcare system where we throw people who are promised healthcare out of the system like they're doing in Massachusetts?
We need insurance, but maybe we need insurance for catastrophic care, not for everyday care.
People need to take responsibility themselves for their own health care. To me, the most disturbing thing about this whole thing is the process that's going on. And I can't understand why, for something so important that involves something like 20%, it's approaching 20% of our gross domestic product, we have to rush this through with our representatives basically caving into the notion that this has to be done this weekend.
Why aren't they listening to the Congressional Budget Office and their report about how this is going to drive up costs?
If you look at Medicare is going bankrupt.
The Medicare rules and regulations cover hundreds of thousands of pages in disparate volumes. They make the IRS code look like Cliff's Notes. And so physicians wind up trying to not expose themselves to healthcare fraud, which is a federal crime, by the way. It's a bad, bad crime. And you can do it by not crossing the right T's or dotting the right I's inadvertently. It's still fraud.
We need to have a national debate that includes doctors and patients. And I much prefer a ground level up kind of approach rather than a top-down level approach that we're doing now.
I've worked in the United States Navy. I know that government healthcare can work, but I also know that people go home at 3 o'clock in the afternoon because they're not incentivized to stay late.
Primary healthcare is in crisis, and the American Academy of Family Practice and American College of Physicians have both written position papers saying we're going to go extinct. So physicians really should be standing up saying, we got to fix this.
If we mobilize those people and we get all of us collectively to call our congressman and to actually go at this problem from a grassroots level, that's how we're going to change the system. That's how democracy is supposed to work. Not ram things through in a rush without anybody reading what's being put on paper.
August is the time for action. This is a time when Americans either engage in this debate and tell Congress they reject government-run healthcare or sit silently by while Congress forces it onto them.